Hello friends, and welcome to our channel. Today I want to ask you a very simple question. Do you have garlic in your kitchen right now? I believe the vast majority of you would say yes. For centuries, garlic has been more than just an indispensable, delicious seasoning on our tables. It has been hailed as one of nature's most powerful medicines. The artisans of ancient Egypt used it to fight infections and maintain their strength. And modern doctors widely recognize its outstanding protective effects on heart health. Modern scientific research has confirmed that this tiny bulb is indeed a superfood. It can help us lower blood pressure, boost our immune system's fighting power, improve circulation throughout the body, and it has even shown astonishing potential in combating certain types of cancer. But here is a huge problem, one that is overlooked by the vast majority of people. Up to 99% of middle-aged and older adults may be handling and consuming garlic incorrectly every single day. And these seemingly trivial mistakes are quietly and systematically stripping away almost all of its healing powers. This is no exaggeration. A study published in the prestigious American Journal of Medicine clearly stated that one simple common mistake could reduce the effectiveness of your heart medication by up to 51%. Imagine that. You think you're protecting your health with natural foods. But in reality, you might be unintentionally shutting the door on its most precious health benefits with your own hands. But please, don't worry, because today, all of that is about to change. In this video, we will reveal, with unprecedented depth, the 10 most common and most critical mistakes when it comes to eating garlic. And more importantly, we will tell you exactly how to fix them. To help you better understand and remember, I've specifically organized these 10 mistakes into 3 categories, based on their risk level. First are 2 fatal risks. These are red lines that could be life-threatening under certain circumstances, and you must stop them immediately. Then, there are 4 health-damaging risks. These are habits that will slowly erode your health over time. And finally, 4 benefit-reducing risks, which, while not directly harmful, will make the garlic you eat almost completely ineffective. Please, make sure you watch this entire video. By the time it is over, you will know exactly how to make every single clove of garlic work like a precision-targeted medicine to efficiently strengthen your heart, calm inflammation in your body, and build a powerful fortress for your immune system. Let's begin. Part 1. The 2 fatal risks. These are red line behaviors you must stop immediately. First, we need to talk about the 2 highest-level mistakes that, under specific circumstances, could directly threaten your life. Please pay very close attention. Fatal mistake number 1. Consuming garlic before surgery. Friends, please remember this sentence. Even a thin slice of garlic bread can become extremely dangerous when you have a surgery appointment. The science behind this is crystal clear. Garlic is a natural and potent blood thinner, also known as an anticoagulant. It works by inhibiting platelet aggregation. In everyday life, this property is very beneficial for preventing blood clots and protecting the heart and blood vessels. However, on the operating table, this advantage instantly turns into a fatal flaw. When a surgeon needs your blood to clot normally at the incision site, high concentrations of garlic's active compounds in your bloodstream can make this process incredibly difficult, dramatically increasing the risk of uncontrolled bleeding during and after surgery. The medical evidence on this is overwhelming. The New England Journal of Medicine, a top-tier global medical journal, once published a landmark review article. After analyzing thousands of surgical cases, researchers found that a staggering 8.7% of serious bleeding incidents were directly linked to patients consuming garlic within a week before their surgery. The study also quantified the risk. Patients who ate more than 2 cloves of garlic daily had their bleeding time prolonged by an astonishing 250%. What is even more frightening is that if you are also taking other medications or supplements that thin the blood, like aspirin, fish oil, or vitamin E, the risk multiplies. Medical literature has documented a real case where a patient, simply because they didn't stop eating garlic before a minor procedure like a tooth extraction, nearly went into shock from blood loss right there in the dental chair. So, the solution here is an ironclad rule, with absolutely no room for negotiation. Before you undergo any type of surgery, and this includes but is not limited to major operations, tooth extractions, biopsies, or even a colonoscopy, you must at least 10 to 14 days in advance completely stop consuming all forms of garlic. This includes raw, cooked, powdered, and any supplements containing garlic extract. Furthermore, you must proactively and clearly inform every member of your medical team about your garlic intake. including your doctor, anesthesiologist, and nurses. If it is an emergency and you don't have time to stop in advance, you must inform them immediately so they can prepare emergency measures like clotting factors to manage potential major bleeding. Fatal mistake number 2. Taking it with specific prescription medications. This is a silent killer. Many people underestimate the bioactive power of garlic, not realizing it can interact dangerously with prescription drugs you're taking. Just like another medication would, one of garlic's core effects is to amplify the power of certain drugs, leading to very dangerous consequences. Here is a high-risk medication list. Please check it carefully. The first and most dangerous category is anticoagulants or blood thinners. For example, warfarin, aspirin, clopidogrel, and so on. If you are taking these medications and then add a large amount of garlic, it is like adding fuel to the fire of your anticoagulant therapy. It will greatly increase the risk of severe internal bleeding, such as the most terrifying, an intracranial hemorrhage. A study in the American Journal of Hematology reviewed 71 cases of non-traumatic intracranial hemorrhage and found they were all linked to patients taking both garlic and anticoagulant drugs. Among them, a shocking 34% of the patients ultimately died as a result. The second category is blood pressure medication. Garlic itself has a mild blood pressure lowering effect. If taken in large quantities with antihypertensive drugs, it can cause your blood pressure to drop too low, leading to severe dizziness, blackouts, and even fainting and falling, which is extremely dangerous for older adults. The third category is diabetes medication. Whether you're on metformin or injecting insulin, garlic can enhance their blood sugar lowering effects, leading to severe and dangerous hypoglycemia. Symptoms of low blood sugar include trembling, cold sweats, confusion, and in severe cases, even a coma. A study on diabetic patients showed that 31% of patients experienced a severe hypoglycemic reaction when using their medication and consuming large amounts of garlic simultaneously. Additionally, garlic may also affect the effectiveness of certain antiviral drugs, like sacubitril for HIV, and birth control pills. So, what is the solution? First, if you are taking any of the medications listed above, you must consult your doctor or pharmacist before you plan to increase your garlic intake or start taking garlic supplements. This is a non-negotiable step. Second, using a small amount of garlic for flavoring in daily cooking is generally considered safe. But the key is to keep your intake consistent. Don't eat none today, and then a whole head tomorrow. Finally, you must learn to closely monitor the warning signs from your body. For example, unexplained bruises, frequent dizziness, or sudden drops in blood sugar could all be dangerous signals of an interaction between your medication and garlic. Part 2. The 4 health-damaging risks. These are habits that are slowly eroding your health. All right, now that we've covered the 2 fatal red lines, let's look at 4 equally important, but more subtle and long-term health-damaging mistakes. Damaging mistake number 1. Eating raw garlic on an empty stomach. In many health and wellness circles, there is a popular saying, eating a few cloves of raw garlic in the morning on an empty stomach kills bacteria and boosts immunity. This advice sounds natural, but for many people, especially older adults with sensitive gastrointestinal tracts, this is like playing with fire. The science is that raw garlic contains a large amount of sulfur compounds, which are extremely irritating. When your stomach is empty, there isn't enough food to act as a buffer. So these irritants act directly on your stomach wall. On one hand, they overstimulate stomach acid production, and on the other, they can directly damage the precious mucous membrane that protects our stomach. For those who already have gastritis, stomach ulcers, or irritable bowel syndrome, also known as IBS, eating raw garlic on an empty stomach is like turning a natural remedy into a dose of poison. Let's look at some data from Korea National University. They conducted a study on 89 patients with stomach ulcers. The results showed that among those who had a long-term habit of eating raw garlic on an empty stomach, a staggering 42% experienced severe gastric bleeding, and 18% of those were so severe they required emergency blood transfusions. I know a gastroenterologist who works in Miami, and he once shared a memorable case with me. One of his patients, an elderly gentleman very focused on his health, was convinced that eating 3 cloves of raw garlic every morning was the secret to his vitality. As a result, this habit caused a tiny, undiscovered ulcer to perforate, and he ended up in the emergency room vomiting blood, requiring emergency surgery. So, the correct solution is this. First, never eat raw garlic on an empty stomach. Always consume it during or after a meal. It is best to eat it with foods that can neutralize and buffer stomach acid, like milk, yogurt, or bread. Second, consider heating the garlic slightly. A little bit of cooking can reduce the irritating compounds by up to 60%, while still preserving most of its health benefits. Third, there is an excellent alternative, which is aged black garlic. Black garlic undergoes a long fermentation and aging process, which greatly reduces its pungency and gives it a mild, slightly sweet flavor. Moreover, its antioxidant capacity is even stronger than raw garlic, making it very suitable for seniors with sensitive stomachs. Damaging mistake. Number 2. Excessive consumption of raw garlic. There is an idea that if something is good, then more of it must be better. This idea is an extremely dangerous trap in the world of health, and garlic is no exception. Some people, in pursuit of so-called potent effects, eat a dozen or even a whole head of raw garlic every day. What they don't know is that once you exceed a safe dose, garlic can switch from being an antioxidant to a pro-oxidant. An excess of active compounds from raw garlic can begin to attack and destroy red blood cells in our bloodstream, leading to a condition called garlic-induced hemolytic anemia. The initial symptoms might just be fatigue, weakness, or darkened urine. But if it continues long-term, it can lead to severe damage to vital organs. Stanford University Medical Center once documented 67 cases of hospitalization due to garlic poisoning. The common factor among these patients was that they were all eating between 15 and 30 cloves of raw garlic daily. Among them, 23 people developed chemical burns in their esophagus, and 11 developed anemia so severe that it required blood transfusions. So, what is the guideline for a safe dosage? For a healthy adult, 1 to 2 cloves of fresh garlic per day is enough to get the vast majority of the health benefits it offers. As a safe upper limit, do not exceed 4 cloves per day. Please remember this core concept. Overdose is not exclusive to medicine. Even the healthiest food on earth can become poison when consumed in excess. Damaging mistake number 3. The wrong storage method. You might not think so, but storing garlic in the wrong place can not only make it lose its potency, but it could even allow it to produce a deadly toxin. There are 2 common mistakes we make. The first is putting a whole head of garlic in the refrigerator. The cool, damp environment inside a fridge is the perfect breeding ground for garlic to sprout and grow mold. Sprouted garlic isn't toxic, but it uses up the nutrients in the bulb itself, causing a decline in its core medicinal component, allicin. The second is storing garlic in a sealed plastic bag or container. The lack of air circulation causes moisture to build up, and the garlic will quickly become soft, moldy, and develop an unpleasant bitter taste. But both of those mistakes are minor compared to this next one. The most fatal storage mistake is soaking garlic in oil at room temperature. Placing minced or whole garlic cloves in oil and then leaving it on the kitchen counter provides the perfect growing environment for an anaerobic bacterium called Clostridium botulinum. It is an oxygen-free, moist environment. The bacterium itself isn't the scary part. What is scary is the botulinum toxin it produces as it grows. This is a colorless, odorless, but extremely potent neurotoxin, tens of thousands of times more toxic than cyanide. If ingested, it can cause muscle paralysis, respiratory failure, and even death. So, what is the garlic storage code of practice? For whole heads of garlic, please store them in a cool, dark, and well-ventilated place. Like your pantry, use a mesh bag or a paper bag for storage, which can keep them fresh for up to 2 to 3 months. For peeled garlic cloves, you can place them in a sealed glass container and store them in the refrigerator. But they will only last for a maximum of 7 to 10 days. For minced garlic, it oxidizes very quickly and should be used within 24 to 48 hours. If you absolutely must store it in oil, remember, it must be refrigerated at all times, and it must be used within 1 week. Damaging mistake. Number 4. Swallowing whole cloves of garlic. Some people, to avoid bad breath after eating garlic, or simply for convenience, choose to swallow whole cloves, thinking they can still get the health benefits. This is a huge misconception. The core of this mistake, which we will explain in detail shortly, is that the most powerful medicinal compound in garlic, allicin, does not naturally exist in garlic. It requires an activation process. If you swallow a whole clove, its cellular structure is not broken down, and the activation reaction will not happen. That clove will pass through your digestive tract almost completely intact, and you will get almost zero medicinal value from it. It is like buying a bottle of expensive vitamins, but never opening the capsule and just passing the whole thing through your system. It is a complete and total waste. Additionally, your body will have a hard time breaking down a whole clove of garlic, which could cause stomach discomfort and gas. So, the solution is simple. Before you eat it, you must slice it, crush it, or chew it thoroughly. Part 3. The 4 benefit-reducing risks. These are mistakes that make your garlic useless. Finally, let's talk about the 4 most common benefit-reducing mistakes. These mistakes won't directly harm you, but they will drastically reduce the health value of garlic, making you waste this superfood. And all 4 of these mistakes revolve around one core scientific concept: Allicin. Benefit-reducing mistake number 1. Cooking it immediately after chopping. This is about the crucial golden 10-minute rule. This is probably the mistake that 99% of households make every single day. We finish chopping the garlic, and sometimes, when the oil in the pan is already smoking, we hastily toss in the minced garlic. Now, I am going to reveal the most important chemical secret behind garlic. Garlic itself does not directly contain its most powerful medicinal compound, allicin. Allicin is a potent sulfur compound, responsible for garlic's signature aroma, and the vast majority of its health benefits, like being antibacterial, antiviral, lowering blood pressure, and anti-inflammatory. The creation of allicin requires an enzymatic reaction. Inside a whole garlic clove cells, 2 substances are stored separately. One is called allicin, and the other is an enzyme called allinase. Only when garlic is chopped, crushed, or chewed, and the cell walls are broken, can these 2 substances meet and react chemically to produce allicin. And here is the key point. This chemical reaction needs time. If you throw freshly chopped garlic into a hot pan immediately, the high heat will instantly deactivate the delicate allinase enzyme. Just like dropping a raw egg into boiling water, it solidifies instantly. Once the allinase is deactivated, the reaction that produces allicin is permanently stopped. So, what is the solution? It is our golden 10-minute rule. Scientists at Pennsylvania State University discovered through experiments that after mincing or crushing garlic, letting it sit at room temperature for 10 minutes before cooking or eating it, can increase the final amount of allicin produced by up to 19 times. That is 1,900%. Research from the Journal of Nutrition also confirms that this short 10-minute wait can significantly preserve garlic's cardiovascular protective abilities and anti-inflammatory properties. So, please remember this simple action. First you chop, then you stop. Those 10 minutes are not a waste of time. They are powering up your garlic, transforming it from a simple seasoning into a true medicine in your hands. Benefit-reducing mistake. Number 2. Overcooking the garlic. Related to the last mistake, even if you wait for 10 minutes to let the allicin fully develop, the wrong cooking method can still destroy it. Many people are in the habit of tossing garlic into hot oil at the very beginning of cooking to infuse the flavor, letting it fry in the pan for over 10 minutes. The science is this: allicin is very fragile and extremely sensitive to heat. When the temperature exceeds 140 degrees Fahrenheit, which is 60 degrees Celsius, it begins to break down rapidly. So prolonged high-heat cooking will not only cause garlic to lose almost all of its medicinal effects, but it will also create a bitter taste due to the over-oxidation of sulfur compounds. There are 3 correct solutions. First, add it at the end of cooking. In the last few minutes before your dish is ready and you turn off the heat, add the minced garlic and stir-fry it quickly. This way, you get the aroma and you preserve the maximum amount of allicin. Second, use gentle heat. If you really need to start a dish with garlic, please use low to medium heat and sauté it quickly for about 30 to 60 seconds. As soon as you smell that rich garlic aroma, immediately add other ingredients like vegetables to lower the oil temperature with their moisture content. Third, maximize raw consumption. Using fresh raw minced garlic in salad dressings, dips for cold dishes, or mixed into yogurt or hummus is the ultimate way to get the most potent and complete allicin. Benefit-reducing mistake number 3. Using pre-peeled or jarred garlic. We all understand that for convenience, many people buy pre-peeled garlic cloves or jarred minced garlic from the supermarket. But the price you pay for saving a few minutes is almost all of the health value. The science is this: the outer skin of the garlic is its natural protective layer. Once that skin is removed, The active substances inside begin to oxidize from exposure to the air, and the precursor compounds for allicin are rapidly lost. Furthermore, these pre-processed garlic products have a very short shelf life, are more prone to bacterial growth, and their flavor is greatly diminished, becoming bland or even sour. And as for jarred minced garlic, it usually contains preservatives, large amounts of oil, or acidic substances, like citric acid, to extend its shelf life. These additives can further neutralize or destroy garlic's medicinal properties. So, the solution is simple, but it requires your commitment. Always buy whole garlic heads with their skins tightly wrapped and intact. Only peel and chop it right when you need to use it. This is the only way to ensure you are getting the maximum freshness and potency. Benefit reducing mistake. Number 4. Choosing low-quality garlic. This is the most fundamental mistake of all, and the one most easily overlooked. If the raw material you start with is of poor quality, then all your subsequent efforts will be for nothing. How do you judge the quality of garlic? It is very simple. Low-quality garlic will feel soft and spongy when you squeeze it, or it might be visibly sprouted, shriveled, or even have black mold spots on the skin. These are all signs that its water content and core active compounds, like the allicin precursors, have significantly degraded and been lost. High-quality garlic, on the other hand, should feel firm and full, be heavy for its size, and have dry, tightly wrapped skin. The call to action here is this. Please think of garlic as a medicine you get from nature's pharmacy. You would never take a prescription drug that is expired and spoiled. So please, do not choose garlic that is no longer fresh. Conclusion and call to action. All right, friends. Today we have systematically analyzed the 10 critical mistakes of consuming garlic, and we've divided them into 3 levels: fatal, health-damaging, and benefit-reducing. Garlic is truly a gift from nature, a powerful tool that can build our health. But please remember, any powerful tool can cause harm in the hands of a careless user. But the good news is, for every single mistake we discussed today, there is a simple, clear, and scientific solution. This means that the choice and the control are completely in your hands. If you found today's video valuable, please give it a thumbs up, share it with the people you care about, and subscribe to our channel and turn on the notification bell. Because here, we will continue to bring you more science-based health knowledge that can truly empower your later years. Please remember, health after 60 is not determined by fate. It is born from every small, correct choice we make today. Stay healthy. We'll see you in the next video.